Today I was sitting in my clinic, this was in the afternoon, about 2 o'clock. There was one, my nurse came and put a card on the table. The patient's name, of course, not Khatija, I just used Khatija as an example.
Okay, right, yeah.
So Khatija, 22 years old. So I opened the door and said, please come in, Khatija. She looked all so flushed, like about to burst into tears, you know. I said, Khatija, you look very disturbed, how can I help you? She broke down, started crying. So I told my nurse, bring a tissue and let her wipe. So I said, tell me what happened. She said, doctor, I'm a medical student. Then I looked, PPUM hostel. So she said, a medical student, which year? No, actually I got 3 more months to graduate as a doctor. But today I couldn't take it. I went to the 4th floor of the PPUM hospital. I wanted to jump down and commit suicide. Then I thought to myself, my father is a fisherman in Terengganu. My mother sells sayur in the market. And I was a government scholar. So they're all having great expectations of me because I'm going to graduate in 3 months. But today when I was doing my rounds, my boss called me stupid, you fool and all. He called me by those names. I couldn't take it. I'm going to be a doctor in 3 months and my professor is calling me stupid and fool. How am I going to pass the exam? So I listened to a story. I said, then what happened? She said, I changed my mind and I came downstairs and I saw this taxi waiting. I went and sat in the taxi and told the fellow, I'm a Tengo doctor. And this guy was going and going and going, I don't know where. And suddenly when I came and got in, I saw Polyclinic Central and Surgery Jalan Gombak. So I asked the guy, why you brought me here? He said, you wanted to see a doctor, isn't it? This is my doctor. I've been a patient of this Dr. Kumar for the last 40 years. You go and see him, he'll help you out. So I said, okay, fine. So I told her, Khatija, when I was a student, my professors used to scold us also like that. Even when we were houseman also, the boss would say, stupid, you, what nonsense are you doing? But I must tell you that, why he a professor? Because when he was a student, his professor would have scolded him like that. And after all this kind of story, didn't we become good doctors? Can you see how many patients, the whole row of chairs are all full? People are coming to see me. If I had thought like you, how would I become a good doctor? The moral of the story is, good doctors are made. You make yourself into a good doctor. University only teaches you the art, the science.
Yeah.
But medicine is a practice of science and art. So when you come out of the GP, you must practice the art of medicine. Science and medicine, everybody knows. The material, which university you went to, everybody has studied the same science. But art is one that we are trained differently. So anyway, to cut the story short, she said, doctor, I feel so relieved after talking to you, love. Because you say you also got scolded, but you got so many patients waiting. Then I have confidence in myself. So okay, chatted with her and then she went off. 3 months later, I had one of my brother-in-law said, Kumar, I got chest pain and I'm sweating. I said, take a cab, come straight to PPUM emergency department, and I drove my car and went there. When I went into the clinic, my brother-in-law was already being examined by the doctor. So I introduced myself and I was talking to him. Then he was saying, you know, this, I'll send the blood for some tests, we'll see whether heart attack or not. And suddenly I heard from Dr. Kumar. I turned and I saw this girl. I couldn't recognize her because she was having a tudung and also I thought maybe one of the doctors who worked in my clinic before. So I said, have you been doing any locum in my clinic? No, doctor, I'm Khatija. You remember one day I came to your clinic 3 months ago.
Wow, she can remember you.
So I said, how are you? She said, I'm happy now, I'm working in emergency department. I said, see, that time what were your thoughts? Look at where you are today. I'm so happy to see you doing it, and I'm glad that I could be the, what we call as a change.